spotting in early pregnancy can be a source of concern for many expectant mothers. Understanding the potential causes can help you alleviate your worries and ensure timely medical attention if needed. So in this video, we'll be talking about spotting in early pregnancy. The first reason why there is spotting is implantation bleeding. That is one of the cause of spotting in early pregnancy. This occurs when a fertilized egg attaches to the lining of the uterus, causing light bleeding. Implantation bleeding typically occurs around the time you expect your period, so it's lighter than your period. It's not haze. So this is a picture of implantation bleeding. It's like a very light bleeding. In some people, it's bright red, while in some people, it's dark red. So, whichever one you get, and make sure it's lighter. The next one is cervical irritation. Increased blood flow to your cervix during pregnancy can make it more sensitive and prone to irritations. This can occur if you have a sexual intercourse or a pelvic examination while you're pregnant, and the use of vaginal suppositories and medications. It causes irritation of the cervix. As you can see in this picture, the cervix is irritated. Then you see the normal cervix. So this can lead to abnormal spotting or bleeding after the procedure or after insertion of those drugs. The next one is subchronic hemorrhage. In some cases, spotting may be due to a subchronic hemorrhage, which occurs when blood accumulates between the uterine wall, that is the fetal membrane. Why this hemorrhage can cause spotting? So when there is blood in the uterine area while you are pregnant, it can lead to spotting. As you can see in this picture, the baby is there, the placenta, the chorionic membrane, and the amniotic sac. So all are there. Then you now see the hematoma, that is the bleeding behind the baby. Then the next one is ectopic pregnancy. One of the reasons you spot in early pregnancy is ectopic pregnancy, where the fertilized egg implants in other areas rather than the uterus. So this can cause abdominal pain and discomfort. Funny enough, this ectopic pregnancy lasts only but 2 weeks only after fertilization, and you will start developing some symptoms that can prompt you to for medical checkup. But if it is ignored, it can lead to a very serious medical emergency like loss of consciousness and the rest in case. So the next one is miscarriage. Then miscarriage is one of the most common cause of spotting in early pregnancy. Miscarriage is the loss of pregnancy before 20 weeks. That is when you lose your pregnancy before 20 weeks, you can term it miscarriage. So this miscarriage can lead to vaginal bleeding, nausea and vomiting, fatigue, you're always tired, lower abdominal pain and cramping. Then light to heavy bleeding. It will start from light bleeding, then to a heavy bleeding, irregular uterine bleeding, and pain. So the next one is infection. Infection and other conditions can be the reason why you are spotting in your pregnancy. For example, if a woman has fibroid prior to her pregnancy, that woman is prone to have spotting even throughout her pregnancy. In some certain cases, they even bleed. So it's important to note why you are spotting. It can be alarming. So it doesn't, maybe sometimes it might not indicate a problem. So that is why you always consult your healthcare provider if you experience any sort of spotting during pregnancy. So This spotting should be treated as a very serious medical emergency because any delay can lead to loss of fetus, and is not good for a woman psychologically and otherwise her baby. Thanks for joining today's video. I hope you find this video interesting. If so, subscribe, like this video, and engage in all our videos. See you in the next video. Thank you.